And there are increasing calls for authorities to ramp up efforts to fight gender-based violence in the Klerksdorp-based Matlosana local municipality, which is in the northwest. Police stations in that area are registering a high number of sexual offences, including in the Jouberton Police Station, which is in the top 10 countrywide. Members of one family here are asking for justice following the separate deaths of loved ones. They claim they have not been helped by the police station. Their daughter was brutally killed, allegedly by her boyfriend, while their son was, in a separate incident, allegedly set on fire by his girlfriend.
A distraught family in a quest for justice. Their daughter, Mutlipuli was allegedly stabbed to death by her boyfriend last month, while their son, Balisem Mukuma, was allegedly burnt in a shack by his girlfriend in September. He died 5 days later. Mukwena's boyfriend was arrested following 3 protest marches to the police station. The family says seeking justice has been strenuous.
Why this boy is so free? Because he brutally killed my daughter. Because the wound in my daughter's body is everywhere. On the neck, on the hands, on the private part, on the right leg, even on the stomach.
He was burnt inside the shack in Sunnyside by his girlfriend. She even tied his hands. When I got there, I saw him running towards the ambulance. He just apologized to me, saying Lerato burnt him. Police have not done or said anything.
Organizations against gender-based violence allege that police are not doing enough to collect evidence and attributed some of the unsolved cases to crime scene contamination.
We have been dealt with these cases for previous years, for the past 10 years, if I may say. The challenges that we are having in particular is of the police, where they are not dealing intensively with the cases.
Our first-hand information was that at the scene of matters that we visited, the officers didn't secure, the scenes properly. Hence, you find the suspects going out scot-free.
While the police implored on communities to report any suspected crime contamination, withdrawal of cases has also been highlighted as a hindrance to justice.
In some instances, some of the scenes will find that they've been contaminated, but where our members are also involved in terms of making sure that they don't give proper attention to such cases, I must indicate that that must be reported to us so that proper actions are taken. But like the first speaker also indicated, we also experienced a situation whereby some of the cases, complainants also withdraw them after opening them. And remember that you spend a lot of resources to make sure that you investigate the case, and only to find that at the later stage the complainant decides to withdraw it. And actually even the interference by some family members, because we have also realized that some of the family members, they do also have a hand in making sure some of the cases are also withdrawn.
The arrested boyfriend is expected to apply for bail on Wednesday, while the woman suspected of setting alight her boyfriend has not been arrested yet. Tebogo Phakedi, SABC News, Jouberton outside Klerksdorp.
What a difficult story. Let's stay with the steam and speak to this now. In October, Health Minister Dr. Joe Phaahla said healthcare workers will now be forced to report cases of pregnant girls below the age of 18. He was replying to a written question in Parliament, and this, of course, as we've seen, some of the disturbing numbers of babies having babies. Let's look at what happens now at a practical level and how this can be done, and speak to Soul City Institute CEO Phinah Kodisang. Phinah, thank you so much for your time this evening. I'm going to just start before we even get into, the babies having babies. We are in the 16 days of activism, and I wonder, from where you sit as Soul City, do these campaigns actually work and yield result on the ground?
The effectiveness of campaigns works if there's a commitment to follow through on the commitments being made during campaigns, right? So you'll hear in this period a lot being said, even I think yesterday or the day before, I think it was yesterday, our president was attending the AU Men's Conference, and I know he made some pronouncements there where he's committing that patriarchy would be dealt with and all those things. But we know once the campaign ends, come the 10th of December, we all go back to normal. You know, we are now celebrating Christmas, we are now beginning the new year, and until we now see a case happening, we say something, come the 25th of November, we are all talking gender-based violence. It's not helpful. It's not a working formula, and it's a formula that must be discarded, and we must be intentional and do what we say we want to do and achieve all those things as we plan to achieve them.
Especially when one, even reads through some of the commitments that were made at GBV summits, just how some of them are just lacking, and we're simply not doing any, seeing any movement in that particular regard. But let's go to this area of concern that you and I are discussing tonight, and this is around teenage pregnancy. And these are babies having babies, and it really is concerning in some of these cases. And I wonder if there's enough of a coordinated effort to ensure that these are reported and we see perpetrators also being brought to justice. Do all the role players speak to one another?
Unfortunately not. And I'll tell you why I say that. Firstly, we must even correct our languaging around this, right? When we talk teenage pregnancy and statutory rape, we're talking completely different things. And even, isolating statutory rape from rape, doesn't show us a true picture. Rape is rape. But we isolate it because here we are also trying to show the level and the extent to which it even affects children, right? And so a 10-year-old presenting in a clinic pregnant, a health facilitator, there are a healthcare worker in that facility should know what the law says. The law is very clear. Anyone who's under the age of 16 can consent for sex, and therefore a 10-year-old being pregnant means a violation of the law has happened. And, there are different acts that have been passed in our country. We have the Children's Amendment Act, which is part of the criminal law, under the sexual offences related matters, right? We also have the Child Care Act. These acts speak of the duty to report. And they list, if you go to those acts, they list very clearly who is supposed to do the reporting. Medical practitioners are mentioned in there, teachers are mentioned in there. It doesn't exonerate anyone. Even parents have a duty to report. So it starts in the home with me as a parent being concerned, seeing my 10-year-old being pregnant. I need to know that a violation has happened, and therefore I need to take the matter forward. But when they present in a facility, because you were mentioning what the Minister of Health said, it's not even opinions, but it's what is stated in the law. There's a duty, an obligation that is placed on these professionals who see these children, including dentists. I mean, it mentions a whole array of professionals. And there's a Form 22 that they need to fill in so that, the process of taking the matter forward can happen.
So, Phinah, let's help a parent, possibly tonight, and a healthcare worker, but mainly the parents, because, we find sometimes in some of these cases, a parent would say, my child has been threatened, and they've been told they need to be silent, and they simply aren't cooperating to tell me who got them pregnant. I don't know what to do. I've tried everything. I don't know how to get them to speak. What do they do then?
Social workers have a role to play in there. They are trained, it's their profession to be able to handle such sensitive matters in a way that, would make the child feel safe to disclose what has happened. So parents on their own might not succeed, but they need to involve social workers who would then follow the protocol that they are trained to follow in terms of addressing these matters. And of course, then the social workers would involve the police. Where the chain gets broken is where everybody washes their hands of being responsible for reporting, where everyone says, but it's not me. No, it should be this one. Why should it be us and not this one? That's where we create an enabling environment for perpetration to continue.
So, Phinah, then talking about that very case, briefly then as we end off our conversation, the case of this, the broken line. I wonder from where you are sitting and where you are working in that space, do you see effective collaboration between the Department of Social Development, Education and Women and Children to tackle some of these challenges that we are talking about?
Not in an effective way. And I don't remember like we saw with COVID, where all departments would be singing from one hymn book around what needs to be done. Coordination, which is pillar one of the NSP on GBV, is lacking. Accountability is lacking. It would be good to hear all of them saying the same thing in one platform. Then we know if we go to this department, they'll tell us exactly what the other department will tell us, including DBE, in that list of departments. So it's fragmented and it's worrying.
And, I hope we do get to speak about this in future, especially because if it's a fragmented approach, then how do we begin to have everybody at the table to be able to tackle this crisis? Because we're still touching on this, but we haven't even spoken about, the justice part of this conversation and what it looks like for the perpetrators. But I'm told we're out of time, and I hope we get to speak about this again. Phinah, I do appreciate your time this evening. That was the Soul City Institute CEO, Phinah Kodisang, as we talk about this very, very disturbing, story. And you think about the fact that we are in the 16 days of activism. We're going to see the end of it. Do we see any results on the ground? That, of course, is the big question.